Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH Samriddhi International Webinar Series at milestone of 3033 plus 43 now, sorry. So we have great speaker. I have Dr. AVTAR Singh sir from London, UK, very senior, knowledgeable, expert, and the person with zeal to manufacture and produce all Ayurvedic medicines as much as possible with his own hands and give it to patients. Thank you, sir. Welcome. I would like to welcome Dr. Dev Prasad Das ji, Dr. Panda ji, Principal Sahib, and Vijay Sri ji, Mishra ji, everybody on the platform. So we are going to listen prevention of blindness, how we can prevent, and if your any opinion or any additional comments will be there, then we will be inviting you also. So welcome sir. Avtar sir, namaskar. Avtar sir, इस विषय में हम लोग बहुत चर्चा कर चुके हैं और आज भी ब्लाइंडनेस इतना बड़ा कारण है कि आप समझिए सबसे बड़ी इंपॉर्टेंट बात कि पहले जब टीवी लॉन्च हुआ था तो टीवी लॉन्च होने के बाद मालूम पड़ता था ब्लैक एंड व्हाइट है तो इतनी दूर बैठ के सुनना है, कलर है तो इतनी दूर बैठ के सुनना है। चलिए वो भी गया। उससे बस टीवी आया हमारे पास में, बड़ी इंपॉर्टेंट बात हुई। छोटे छोटे रूम हो गए, 6-8 फुट जगह ही नहीं मिलती, तो वो टीवी हमारा पास में आया। और आगे बड़ी बात तो लैपटॉप की बात आ गई, कंप्यूटर की बात आ गई, जो आंखों के बिल्कुल करीब है और स्ट्रेस देता है, ग्लेयर देता है, आंखों को नुकसान पहुंचाता है। ये सब उसके कारनामे हैं। यदि मैं बात करूं और आगे की, तो चलो लैपटॉप या ये डेस्कटॉप जो भी थे वो कम से कम बड़ी स्क्रीन थे। अब आ गया मोबाइल, और मोबाइल में भी हमको बड़ी छोटी स्क्रीन में देखने की आदत पड़ गई। हर एक की आंखें आप देख लो मोबाइल या कंप्यूटर करते वक्त कहीं ना कहीं स्ट्रेस्ड रहती हैं, संकुचित रहती हैं, आंखों पे प्रेशर पड़ता है। तो अब ये सिंड्रोम, एक नए नए सिंड्रोम आ रहे हैं जो ब्लाइंडनेस को आपकी प्रमोट करते हैं या एग्रीवेट करते हैं। बड़ी इंपॉर्टेंट बात। पहले की लाइफस्टाइल जिसमें इन चीजों का रोल नहीं था, आंखें बचती थीं। आज आंखें बचाने के लिए बड़ी कठिन तपस्या करनी पड़ती है कि हमारी आंखें बच जाएं कम से कम, और हम उसमें ज्यादा अपना योगदान दे सकें। कहीं कनेक्शन उनका, मैं देव प्रसाद दास जी यदि कंफर्टेबल हैं तो मैं देव प्रसाद दास जी को प्रथम आमंत्रित करना चाह रहा हूं। आदरणीय देव प्रसाद दास जी, इफ यू आर कंफर्टेबल, kindly inaugurate this webinar on prevention of blindness. मोटे मोटे चश्मे हर आदमी के, बच्चों के हर घर में चले जाइए, जितने करोड़पतियों के बच्चे हैं, भले ही वो जिम जा रहे हों, कुछ भी कर रहे हों, वो आप चश्मे देख लीजिए, उनके मोटे मोटे चश्मे उनके शरीर पे, उनके चेहरे पे, उनकी आंखों पे आपको देखने को मिल जाएंगे। तो मैं आदरणीय देव प्रसाद दास सर से प्रार्थना करता हूं कि हाउ टू प्रिवेंट ब्लाइंडनेस।
Thank you, sir.
थैंक यू सर।
Sir, two things. One is diabetes. India and China is the capital of diabetes. Due to the complications, blindness is there. Number two, the students, young children, already told, using the mobiles. Mother has no times to take care of the children. He provide a mobile, you will look it. She is busy with her mobiles. So child is affected, old people are affected. Sir, only one way to protect the blindness, sir. Ayurveda Nasya Karma. Every day morning, you put some nasal drops, take herbal smokes, do the Kabala Gandusa. It is simple things that can protect, that can prevent your vision power. Please, Kabala Gandusa, Nasya, the best therapy. Since last 50 years, I am using Nasya in everyday morning.
Wow. Nashya of mustard oil.
Last, no, with Sarabindu oils.
Sarvindu.
Only Sarabindu oil, sir.
Wow.
Since last 50 years, sir. When I joined as a medical officer in 83, since that day I am using every day morning to control my stress, control my visions, control the depressions. So, because sir, doctor is in London, so many people, when I am in Europe, sir, many patients, I always advise to use the Nasya. So in Europe, they call me Nasya doctor. Number one, I prescribe the Sarvindu oils to put in the nose. You start your morning with the Nasya. You see the difference. It may be vision, maybe nasal program, maybe brains, maybe depression, maybe throats. All the urdhajatru vikarishu visheshanasamisati. So I learn it from our teacher Nigam Sai, Professor Nigam.
Umashankar Nigam.
Yes, sir. Kumar
Wow.
Sakandi. And Professor R.S. Singh, my Guruji, Professor R.S. Singh, and my another Guruji, Professor Sachidananda Pandey, who was from Bihar, but he was my teacher in Puri Gopalandu Ayurveda College. And Kuti Sahib in Kerala, S.N. Kuti, another professor of Kaich Panchakarma, he was really the pioneer of Panchakarma, these four doctors.
Oh.
So for control the visions, to improve the vision power, only Nasya, sir. Take ghee and Nasya. It's the two things I suggest. Thank you, sir.
And any homemade formula, घरेलू नुस्खा?
Correct, sir. So I told you Kabala and Gandu, sir. Simple water.
Oh.
You throw that water, Kabala water, to your eyes. Full with that saliva. Morning Kabala water. We throw out that water. You again use and throw and wash your eyes. That saliva can improve, control the infection and improve the vision power, sir.
Great, sir.
And another, sir, when Jagadguru Shankar, Adi Shankar came to the Puri, one of his disciples, his name is Hastamalaka. Hastamalaka. He was the first disciple in the eastern zone, Govardhan Matha. So many times Shankaracharya, Govardhan Pita Puri suggest take the Amalaki every day. That also protect your vision power, sir. First is Hostamulaka. Name is Hostamulaka. Medicine name is Hostamulaka. And American sign also very good to protect the vision power, sir.
In your opinion, which is the best single herb for blindness prevention?
Sir, number one, Amalaki. Number two, sir, that is, sir, what is the name? I forget the name. Punarnava. Punarnava also. Helpings. Yes, sir. Punarnava.
And this moringa?
Yes, sir. Moringa also. Moringa. Sir, moringa is the medicines for the ENT. Moringa is the best medicine for the ENT. Any problem of the ENT and throats. So we have the Sigru. So we have the Sigrugulu.
Yes. Sigrugulu we have.
Sir, in our Odisha Parampara, sir, we use, I saw when I was a medical officer in 83, there is a Netra Bindu. Classical medicine, Netra Bindu. Is supplied by the government dispensary, the government pharmacy. So excellent, sir. Netra Bindu. The lavang is there, other drugs are there. So it is very, very simple, cheapest. Government should make it again. Many traditional medicines, now the government, they stop it, but really they are the very good medicines.
ट्राई कर रहा हूँ वो तो पता नहीं शुरू नहीं हो रहा अभी मैं दोबारा करता हूँ
जोड़िए ना बहुत अच्छा लगा सुन के भी बहुत अच्छा लगा अंजन has gone from our clinic.
Yes, sir. Anjan, sir, also. Yeah, you are right. Anjan, sir. Darby Anjan. And, sir, you cannot believe, sir. I saw my mother. She made, during the Durga Puja, in Basanti Durga Puja, in Saradhiya Durga Puja, she made the Anjan in the house with the pure ghee. And castor oil also.
Yes.
And camphor. We used, when our child, we used the Anjan, homemade Anjan in the house. I saw that. So we have to protect that. That's why I told you, sir. We have to follow the festivals. We have to protect our festival, our parampara. This is the Ayurveda, sir. After some days, we cannot get the herbal herbs. We lost 80% of our herbs. Only vegetables are here. So we have to protect the vegetables, sir. We cannot get Dasamula more. We lost many things.
Right, you are.
So now, sir, our president is a tribal lady. Our chief minister is a tribal leader. His wife is a doctor. It is a high time to do something name of tribal medicines. We have to make, because we don't. So it is high times. We should utilize this scope.
Excellent. Your concept is excellent. Great.
Thank you, sir.
Now I would like to request Dr. Jagat Bandhu Mishra ji. Ajay ji, your opinion on prevention of blindness. Dr. Kamlakant.
Good evening, sir.
Good evening.
Sir, I want to learn from you, sir. I don't want to give any suggestion, sir.
Then also you can suggest also.
Sir, in my practice, I always give Triphala Ghita, both orally and instill in the eyes.
राइट यू आर। आप कहाँ हैं अभी?
Sir, I am from Dhenkanal district of Odisha, sir. And now I am in service, that is in NHM Odisha
और
as AYUSH medical officer, sir.
बहुत अच्छा, जुड़ते रहिएगा दोस्त, आप लोग जुड़ते रहिएगा,
जी सर,
निश्चित जुड़ते रहिएगा ये।
जी सर, जी सर।
आदरणीय अवतार
थैंक यू।
सर प्रणाम। आदरणीय अवतार सर प्रणाम।
वंदन वंदन प्रणाम।
जय हो।
जय हो।
मैं आपका स्वागत करता हूँ। कैसा
अच्छा,
अंधापन रोकें और कैसे हम लोग। जी सर।
यूके सब ठीक है।
जय हो, जय हो, आपका आशीर्वाद चाहिए।
क्या बात।
बहुत सुंदर लग रहे हैं सर, बहुत सुंदर लग रहे हैं।
अजय क्या बात है।
जी सर।
जी सॉरी, वो मेरा ख्याल रिसेप्शन ठीक नहीं आ रही थी, इंटरनेट नहीं आ रहा था, इसलिए आपका
नहीं, कोई
करना ही
बात नहीं
पड़ा
है।
था।
मैं आपका स्वागत करता हूँ।
पता है
आपसे
मेरे को।
प्रार्थना करता हूँ कि आप जो भी हमें आशीर्वाद दें कि कैसे अंधापन रोका जाए। गुरुदेव की जय हो।
ये अंधेपन की जो बात करते हैं, ये बहुत सी कारणों जो आयुर्वेद में हमने पढ़ा था, प्रॉब्लम तो है। अंधेपन की प्रॉब्लम जो है वो कहीं ना कहीं जो आयुर्वेद का हमारा ज्ञान जहां तक हमें मालूम पड़ा कि बहुत से उसके कारण है, उनमें से एक कारण है कि पित्त की प्रकृति बहुत बढ़ जाती है। जब बढ़ जाती है तो ब्रेन की जो ऑप्टिक नर्व्स हैं वो प्रॉब्लम में आ जाती हैं। जो बचपन की जो बात करते हैं, जो बच्चों के बाद में जो हिंदी is after birth or when they grown up, there's so many other reasons: blood pressure, diabetes, and liver problems, jaundice. There are also reason of them. That is, and also many other problem, industrial pollution. Many people I seen the who doing the welding work, they also become the problem. Too much lighting, too much watching TV or telephone very closely, they also losing their eyesights.
पहले वो रख।
Still all the cardiacs, the problem people have the old age, there's diabetes, everybody know. After that when they cataract, they come in the eyes and start problem to the losing their sight. Nowadays have so many operations, so many allopathy is also doing very great job for that one. In Ayurveda also, the many cases with the Ayurveda treatments, so many cases we've seen. Maybe you remember one case is some the nearly 3, 4, 5 years ago. So our Paramitar principal Dr. Gujarwal, Narnaul University, they done very big case. one from the African country's president's daughter. She lost the eyesight completely, and with the Ayurveda, they in the story everybody read that one. They contact our Prime Minister Modi ji. Modi ji say try to Ayurveda. Then they came and that one Dr. Gujrawal, they done that case. It's very feel proud when that case come in this. So with the Ayurveda, we can look after these kind of problems. But in the old time, there's so many Ayurveda formulations. When they're not doing the operation for the cataracts, the eyesight problem, they do with the some like anjan, some kind of the liquid. Nowadays also so many Ayurveda medicine, Ayurveda doctors, natural practitioners in India, they're doing this job to weak eyesight. They give the medicine, some drops, they put it inside. With Ayurveda, you can protect your eyesights. You can slow down if there any problem. Eyesight can improve with the Ayurveda if the properly balance the most of the problem, as I said, the pitta vardhak, people eating lot of things. And the brain also, if the weak, that area, they also can become the brain area. If it's not properly circulate, they can come the problem. There's some IKS also done some cases for the blindness. There was in the UK, some cases I done. The one case was biggest one from near the Birmingham side, that the boy was nearly 34, 35-year old. I got all the hospital reports and everything, all the data, what I'm saying that when I was only that I can discuss that case. How can we, when that case came to me, somebody referred to me that one from one of my patients, they told him. And in the allopathy, they say you can lose eyesight within 3 to 6 months. They done MRIs, everything. Problem was, some people are like when he was driving his car on the motorways, you visit here, they have motorway, have the 4 or 5, east side lanes. People, he don't know when he can go from one lane to second or third lane. Lot of confusing that one. And after that one, they say, no, we can't do anything. If we do the surgery, not much chance on that one, you can become blind. And then he came to me, I checked that one. What I done, if everybody can ask these questions to the patient, my nature is dig too much as a patient, ask many questions. Dr. Joshi know that case, that one. And I asked the question is all the time. This is the very important what I'm saying now. If every Ayurveda practitioner, they are all better than me. I'm not the teacher to any Ayurveda practitioner. I'm still learning. But it's my nature too much dig the any kind of disease, any kind of problem come. So many disease nowadays coming to the eyesight, that is people become the blindness. I ask are you all the time like this one or sometime you okay? If one question solve the problem. Are you regularly blindness coming or he said no, sometime I'm okay. many times become like this one. I watch and ask the question, give him some in my clinic. I check that one and I notice sometimes he same thing he read properly. After 5 minutes, he can't read properly. So then I find out, I don't know how they come in my mind. I'm not the specialist on the eyesight or anything, but I got the experience that one. I want to share that one. I say, can you check up your brain surgery, brain X-ray again, MRI? Because hospital said they can't do anything. They already consultant decided. He said there's no any chance to their eyesight come back normal. Then he was going to India to meet their parents because he want to see their parent before he become the completely blind. I say go there. When you go India, do the MRI. He is from the Punjab, and his sister was in the hospital, head nurse. When they checked that one, I still have that one. He said, "What is the? Why not you telling me here?" I say, "I don't want to tell you until I'm sure." I say, "What about?" I say, "Write it down." There is one I found the problem because I do the Alzheimer patients, dementia patients. What is the problem? Because their problem is too much water is stored in the brain area. I found these kind of all the brain problem, doesn't matter eyesight, doesn't matter other memory lost or Alzheimer or dementia, confusing. Actually, this kapha prakriti is too much cough is in that area, then all our optic nerve also become the problem on the lighting. If they check there, they say they have the bubbles in their brain area. They call soft cysts, that one. After that one, that boy is from nearly 4 or 5 years now. His light is completely, what I done, I take the extra water from their brain, remove it from there. All the extra kapha from the body removed from there. And as soon as this come, he become the normal. He now working in the company. He's still driving their van and everything. So why the eyesight is weak or gone, we lose our sight. There is either the dryness of the brain or either too much water is there stored. When our system is not completely working properly, he also have the very big gut problem and not enough oxygen in his blood. So many reasons. Just our colleague who doing the treatment for this kind of patient, they should, like you mentioning before, I start that one Saptakarma. I give him Saptakarma, the extra water they taken out from the body. Saptakarma is not only take the extra, anything we have when we design for the cleansing the body, I clean the extra water from the brain. That is my treatment for this kind of any problem for the eyesight or anything. And I'll give the medicine, which one give the strength to the brain. There are so many things you can give to them, depend on what is Vata Pitta Kapha. There's in Ayurveda, so many things you have. Okay. And they can give if the iron level is low, try to make the liver more strong. Sometimes blood cell width is too much, they leaving their lot of rubbish in the brain, and bring the normal everything, balance everything, and then you can remove the excess water from there, because you give some medicine which will pass the more urine from the body extra one. Then they slowly, within 3-4 months, he start feeling a lot better. after they check it and they say they have no any problem. So main problem for the blindness, if the optic nerve is that area, if the too much bubble there, water there, they can also block that one. Not only eyesight, the front, from not very expert on that area. I'm do the kaya chikitsa. I do the problem with the brain, but this is the eyesight is special, that one. Many of I with the doctor, but I done that one and with the good result on that one. So if some Ayurveda practitioner thinking that one, if the dryness, many eyes, eyesight people have the very dry eyes. I use I give them do the Trifla kwas and wash with that one. That's also help. And sometimes it's a glands in the behind the eye, they not properly working, underactive. Many people have the too much tears, that one, that is also big problem. We have to be check that one, what is the problem, and that one. And they in Ayurveda have the so many anjans, so many medicine for the put in the eyes, and also so many Ayurveda medicines. We can use that one. And I said they can help the and best people say. I always say that I also used myself. I become the problem nearly 10-15 years ago. I even can't see the from 2-3 meter properly. Why after that one my eyesight is not going coming down. What is my eyesight is nearly 30-40 years, very much similar that one staying. I sometimes I use that one 3-4 things that one the very good remedy that one. The almond godo just soak overnight. In the morning take the skin out, dry it again, put some fennel and the 250 gram almond and fennel put the 100 gram and black pepper put the 25 gram. If then people don't have the diabetes or any sugar problem, they're going to put the 50 gram on that one. If they do the more better, take the pure makhan butter, mix it with that one and eat it that one. That is very good for the brain. Eat it early morning in the first thing. If they make the powder, people don't have that one. Even powder is working very well. All 3-4 things that one. And it's work very well. If they too much pith, just put it something, which one is like a some what is we call the sat galoy. Put it inside that 150 gram, and that become the cover the pithvardik problems on that one. Or mukta shukti, they can put a little bit that one. So calm down the brain, aggressive the pitta on that one. And they are very good that one. 1 spoon morning, 1 spoon evening. Stop the any things we like sour things, pickles. And if you do 2-3 months, that will eyesight definitely improved or stop losing more eyesight. These are very good things. If there's too much toxin in the body, if the gut problem, then you have to look after for the either go to some Panchkarma center or there they can also do the detoxification. And Saptkarma is not so many people doing. That is the only I designed that one. But Panchkarma is everywhere. Panchkarma is also good therapy. It's great therapy, very old therapy. For the smaller thing, if you can take Panchkarma, is not bad. And Shirodhara on that one. And these put the some nasyas inside. They can actually that area is on the brain area, over the neck area, nose area, maybe so much mucus there, that area, so much water there, so much kapha there, that area. This is not necessarily in the whole body have the kapha, but those areas should be cleaned, that one. If they clean that one, then it's definitely eyesight improve, okay? And try that powder. If they're not working, and then go and see your local practitioner. They can check the properly and they can help you a lot. And don't ignore, because eyesight is very important for the whole life. Doesn't matter, but we can save our eyesight, doesn't matter what age. I seen the people 100-year-old, their eyesight is working properly. Wash your eyes, not very hot water, just maybe in the winter lukewarm little bit, but don't hot water use it. In the winter, in the summer, you can use the normal temperature or little cold water. But too much hot, many people I seen they're using too much hot water to the eyes. That is the biggest problem. So if you have some itching or anything, stop any sour things, any pickles, anything, chili, too much chili. Use the black pepper in their diet. That's very good for the eyesight. Even white pepper is very good for the eyesight. And don't ignore if somebody have the problem for the eyesight. Go and check up regularly, once a year. Some people have the diabetes or blood pressure. They definitely have to check after 6 months. Control your blood pressure. Keep the control your diabetes. But don't eat too much sugar if you have diabetes. The problem, if you have blood pressure not under control, ask your practitioner. With the Ayurveda, we do the different way. For allopathic people, they give the medications. Although I don't believe blood pressure is the disease, blood pressure is the symptom of some other problem. I never agree with the blood pressure is any disease. Blood pressure can be controlled very nicely. We done so many patients, blood pressure control, there's maximum blood pressure, we bring down 235, they also become the normal. But definitely until you not control their other body part, what is the reason of the blood pressure? There's so many reasons. Gut is main. And because oxygen is there, people become very quickly angry. People will have the gut problem. If the parasite in the body, then it also become the very angry. And they can't control their emotion, they can't control their thoughts. That one, they never agree with that one. People, they got more problem for the eyesight. So if this is the main reason, so we have to be look after that one. Then you can protect the blindness. For the children who sometimes genetically, when they born, they become the blind. That is maybe I done the study some about that one, allopathy, and I think they are right. When a mother is pregnant, maybe she has a lot of blood pressure or thyroid problems, that one. So please, we have to be look after that time. Not only that time, all the time we have to look after the ladies, okay? When she's pregnant, especially that time, should be special care. Let her relax all the time and not be anger or anything. That is so many reasons for the blindness. We only can protect if we look after them. If we don't look after that time, or even after that one, eyesight is so important. Like if teeth we have cleaning, same we have to twice a day. Before you go to sleep, wash your eyes. There's so many solutions nowadays. They have the washing the eye, any dirt. Because all the day there's a lot of pollution. When we walking outside, driving a motorbike or something, they get more pressure with the air, and with the air, there's a lot of pollution, lot of toxin in the air, they go to our eyes. There's so many reasons people getting more eyesight problem, blindness. So we have to protect or wear the glasses. You can save that one when you're driving the motorbike or any jogging or anything. Don't go without that one. So these are if we protect that one, if we careful from that one, then definitely we can protect our eyesight and live the healthy and enjoy the life. Without eyesight, you can't enjoy anything. You can't see. I've seen the blind people. They are sorry. They are very very. They're not saying anything to anybody, but their life is always in the darkness. I seen in the family they have the one person blind. I always look after him and take it this way, that way, spend some time with them. And they are. I always remember them when I was young. That one. They are very nice people, but they are so much suffering. But they are. We can't say anything. That life is. I seen. The blind people life is not enjoyable. They can't see, can't enjoy. We have to tell them. They asking, "What is this one? What kind of color? He's a nice voice." They are so. Please protect your eyes. Always take the precautions. If anything is funny, if that looks like a tear is coming too much, a dryness coming too much, or something, straightway go and check. Nowadays, lot of science is very advanced now. They're doing the surgery in the eyesight. They are brilliant. The allopathy, the system, the world they were also doing. In Ayurveda also, so many, like I told you, is our Paramitra, Dr. Gujrawal, they proved that one with the Ayurveda. So many, maybe I don't know their name, but I seen that case. I always really appreciate what he done and that one. So with the Ayurveda also you can help with the people who suffering with the eyesight. So protect your eyesight. When you protect your eyesight, you can enjoy. Your family can enjoy. You are not dependent on anybody. So same thing like you protecting your teeth. Eyesight is most important. Look after all the time. Don't go in the very very hot sun. Don't watch the too much sun. So this kind of the precaution we can take it also. Government also, I'm sure they're doing in the universities everywhere. Nowadays, so many good company. There's so many people are they claiming they're doing the eyesight problem, helping to those people. A lot of people working on that one. Good luck to all of them. And people should. What I told that one, that formula is very old formula, and we use that one. If you use even 2-3 months, don't save 1 week or 2 weeks. At least you have to use 3 months. If you use every year 2-3 months in the year, then you definitely get the benefit. Also, they will give you the good memory on that one. So that one, this is the my about the this blindness. That one, how can we protect? How can we say once is blind? That one is very difficulty to. There's no any. I don't think so. Any chance only the transplant the eye, change the the new eyes. Somebody donate that eye, then they can get it. But many blind people even doesn't matter. Somebody donate their eyes, they can get the benefit. So eye is very important than every other organ because without eyes, you can't do any work, you can't go anywhere. You are always handicapped or you always need somebody to help. So many I seen the people who have the blind, but they are still independent. They're doing a lot of job. They are example for the other people, but it's still they are. We have to look after them. We have to protect our eyes, and they are great people who are blind. They're doing great job. They are very very strong people. I seen. So for the eyesight, what I told that one, I'm using that one at least 2-3 months a year. So my eyesight is staying so okay. So use that one. There's so anything else I can say? Any question? Maybe I'm missing, and I'm happy to discuss with our friends. Anybody ask me any question? Sharma ji?
जी सर।
Hello?
जी सर, जी सर।
Any question? You know any? I can discuss. We can discuss on that one.
ये रूरल इंडिया की प्रॉब्लम है सर, यहाँ भारत में। और रूरल इंडिया की प्रॉब्लम हुआ करती थी कैटरेक्ट की वजह से,
हाँ जी,
जो आज टीवी की वजह से बढ़ते बढ़ते अर्बन इंडिया की प्रॉब्लम हो गई।
बिल्कुल ठीक। Yes, you are right.
इसमें कोई ऐसा विशेष सावधानी है जो आदमी रखे और उसे मालूम पड़े क्या वो अंधा नहीं होगा?
It's like you say, the people rural area doesn't matter. Everywhere is now is internet, television, telephones. Everybody watching the programs on that one. Too much light on that one. Lighting go to the eyes. They damaging the system rays, that one. Only until people don't realize this is the human nature, they only find the solution when they're suffering. Until they're not suffering, they've seen somebody else, they don't bother, oh, I'm okay. They don't taking the lesson. This is the biggest problem nowadays. This morning, some patients came from Leicester, that one, and I say to very sorry, last 3-4 months, nearly 5 people in my contact, they passed away. And they also told me in their families, nearly 3-4 people passed. Problem now is after the vaccine problem, everybody know now in the world that protein, the lot of people, they're going to all gone for the heart attack. The young, 50, 52, 53, parents are alive, they are not, because the people don't listening that one. 2 of them, 3 of them, they were family was my patient, and they discussed with me as on the Zoom meeting, we are always saying this one, who took the vaccine, please go any detoxification center, check up your blood and find out if anything you see unusual. Blood check is best solution, and they won't lie. And you can find what is the problem is going on and make the system balance. If now you ask me this one, I definitely say we can take the toxin out with the Ayurveda. Ayurveda doesn't matter any kind of toxin in our nowadays. There's so many plastic in our body. Many people are one other big problem. Maybe I share definitely with that one. We using the tea bags. That's not 100% paper. They have small little things inside the plastic. That is when you put in the hot water, if you put the normal paper, they within second they finish. Why not the finish? Then I done the experiment on that one. The lot of plastic we eating in the plastic container, we eating in the microwave, that one, all the plastic going inside our body. Nowadays, I really today you ask me that one. Definitely, people have to do the detoxification their body once a year or twice a year. At least plastic inside, lot of pesticide outside. What we say. So, one machine came. I share with this one. I bought that one. They call AI. Just put the hand on that one and you all the body system report is come. How many metals we have, how many this one. And that's not the joke, because I got the experience, the one patient of my patient, and he had the cancer and other things, uh, hepatitis B and other things. When he actually introduced me that one, I say you need a blood check again. When he go to somewhere else, their front, he said, I can do. I say, he asked me, can I do that one with that machine? I say, yeah, go ahead. I need the blood check report. When I done, I surprised that one, because I told him, have you, many people filling the tooth, lot of metals inside, mercury inside in their body, they staying there one. Lot of toxin, Dr. Sharma. We not realize we are eating what we eating. That food is not the all the inside the pesticide we're putting that one, lot of matter and industrial waste is coming, lot of arsenic inside that, a lot of chemicals are going all into the soil, and we are eating that one. If we grow in that one, doesn't matter, that soil observe that toxin from there and put it in the come in the food, then we eating that food. Slowly so build up inside. On that, when I seen that result on that one, they have a lot of lead inside, lot of metal inside, lot of arsenic things inside. So how can our body, when they in our body, in our blood, in our system, they also affect the every organ, teeth and everything, and especially who have the lot of filling in their teeth, they are suffering more with the gut. If the gut is weak, the brain definitely becomes the weak. If brain become weak, and definitely people get the ear problem, teeth problem, and eyes problem, and memory problems. Are all in the brain. One patient today, I say, you have that? He say, yes, I have this one. Then I say, if they're filling in the teeth, it's not that area. It slowly stay there. Slowly with the blood, they circulate everywhere. We don't know which organ they can go there. They can go to in the joints, okay? Lot of people have the arthritis, gout, that one. Where they come from? All our diet is nowadays not very good. Only best solution, take it, remove it maximum. Only we can remove it with the cleansing system. Internal system cleansing, we never done. We wash every day our body. We wash our hairs with the nice shampoos. We use the best soap, that one. No, if your body is detoxified, you even no need to use the soap. Automatic clean. You no need to put so much shampoos on your hair, because skin is clean already. Internal layer of the skins are clean. There's no any toxins there. You can get less wrinkles on your skin. These are, it looks like when I say this one, I'm telling that one. I have the many patients. Even some ladies, they ask me what is the best way. I said 3 months, don't use the makeup. In the makeup, lot of lead in the makeup, lot of other problems in the makeup. When we're using on our face, on everything, they go, our body is observing. If we put the oil on our body anywhere, they go inside. If we put anything on our body, they definitely go inside. when they go inside, it's very difficult to come back. And our blood can take it and carry from that one, because that immune system is don't like any rubbish thing, but they want to throw that one, and blood always collect from there and go in other part of the body. Better is don't use too much rubbish makeup, don't use too much soaps, that one chemical, that one. Do go the natural way. Clean your body with the cornmeal, coarse cornmeal. You can clean that one. It's very nicely. You can the all the time. What do they say? The we call in Ayurveda called multani mitti. You can use that one. It's best way. We call arita soap, that one, soap nut. Use that one. That is natural. We can, old time they use hair and washing hair with the yogurt, with the milk, that one. That is was natural. They remove the toxin from there, not make the toxin go into the body. So many people also the using so much the hair dyes. Everybody want to look young, okay? And they're using the lot of hair dyes, and they also can affect the eyesight. Their eyesight definitely become the problem. They are chemicals, they are very strong chemicals. Should we avoid these ones? And I seen that one with my own, when it's some people, they listen to me sometime. And I seen that one, they say they stop using any makeup. And their skin looks like younger than other people, their own age people. They asking, so there 2-3 ladies, they not use it. They say, you are right. We never use the makeup after that. I mean, just normal oil or everything. And this is the best way to protect your eyes, your skin. Skin, eyes, they are all very important things, that one. So any question anybody want to ask? I'm happy to answer that one.
Sir, namaste. Sir, can you please speak about the RP treatment through Ayurveda?
Pardon? Kindly repeat the question. Am I audible to you?
Hello, sir.
Yes, please.
Sir, namaste. Sir, can you tell me some advice for RP treatment through Ayurveda?
Avatar, sir.
Hello.
Yes, please.
Sir, please tell me some Ayurvedic treatment for retinitis pigmentosa, sir.
Yes, we are communicating. Dr. C.P. Sharma, sir.
Okay.
Dr. C.P. Sharma, sir.
Uh-huh.
Avatar, sir.
Yes.
The RP retinitis pigmentosa.
Ayurvedic for controlling.
I can't hear.
RP retinitis pigmentosa, disease of retina.
Yeah, retina disease, as I explained, that one is many type of that disease. We have to, if you find that disease, what is the reason of the disease? And there's so many in Ayurveda. Chandrakala Rasi is also working on that one, very good. Okay. And depend on the what is the problem that one, why they come that one, pigments on that one.
Sir, actually, as per the literary description, it is genetic, sir. But in the RP retinitis pigmentosa, the patient suffers from peripheral vision loss. But I have seen my patient, he has lost his central vision.
Oh.
Sir, can you treat through Ayurveda?
How old is the patient?
Sir?
How
How
old?
old? What is the age?
Sir, 62 years.
Okay, okay. How long he is suffering from that one?
Sir, near about 9 years.
Okay, is he diabetic?
No, sir, no diabetic. Sometimes he get high BP,
Yeah, high BP,
but taking some
diabetes.
Ayurvedic medicines. No diabetes, sir, no diabetes.
No, but blood pressure is also biggest problem for the. Have you noticed why his BP is he take on the medication?
Sir, yes, he's taking medication, but his BP is on control.
No, with the medication, if the control